Hey, I'm Dr. Christian Ruff, one of the cardiologists at Brigham and Women's Hospital, Harvard Medical School, and also a clinical researcher in the TIMI Study Group, which is a large research organization that conducts clinical trials across the spectrum of cardiovascular disease. In that venue, I'm one of the lead investigators of a large clinical trial studying one of the new anticoagulants to prevent stroke and atrial fibrillation. And through my work and my research in stroke prevention and atrial fibrillation and the testing and adoption of novel anticoagulant therapy as an alternative to warfarin to help prevent the devastating complications of stroke, I became very interested in helping to lead the North American Thrombosis Forum's Consensus Initiative for Stroke Prevention and Atrial Fibrillation. So we're very pleased and excited that we're going to be able to participate in the North American Thrombosis Forum Stroke Prevention and Atrial Fibrillation Initiative. This is a really incredible opportunity for all of the professional stakeholders in atrial fibrillation to help prevent and treat patients with stroke and atrial fibrillation. This is a real unmet need. What we've realized, obviously, atrial fibrillation is the most common arrhythmia we encounter in clinical practice. And the thing that we most fear, both as healthcare providers and also for our patients, is the devastating complications of stroke, which are often very severe, frequently fatal, and leave patients and their families to deal with the devastations of an ischemic stroke. We've had warfarin, which was the only available anticoagulant in clinical practice for over 50 years, which is a very effective medication, but one of the most difficult and dangerous that we use in clinical practice, with complications such as severe bleeding, and particularly intracranial hemorrhage or bleeding in the brain, which is devastating in its own right. And physicians and nurses and patients and families have really struggled over many decades trying to weigh the risks and benefits of preventing stroke, but also minimizing the complications of anticoagulant therapy. And in a very exciting time the last several years, we now have several new oral anticoagulants that are available as alternatives to warfarin. And there's been a real explosion of data in the clinical trial community. And what we've realized as we've spoken to other clinicians and nurses and pharmacologists and patients is that there's a real disconnect between the exciting clinical trial data and sort of real-world practical advice for local healthcare providers and nurses about how to use these new agents, which patients should be on a novel anticoagulant versus warfarin. How do you manage their specific patient who's sitting in front of them? And these are really difficult questions. And unfortunately, the clinical trial data in and of itself is not very accessible to people, nor is it comprehensive. And for practical guidance, people are looking to different review articles or professional guidance documents, but they're incomplete. And they generally take many years before they reach sort of a complete synthesis of information. And what we decided to do through the North American Thrombosis Forum is to launch this Atrial Fibrillation Stroke Prevention Consensus Initiative. And really the purpose is to bring together a leading group of researchers, clinicians, nursing, across all specialties that deal with patients with atrial fibrillation and prevention of stroke, including cardiologists, gastroenterologists, hematologists, neurologists, pharmacologists, nursing, and other healthcare support providers, and get them all in one place and develop and discuss sort of ideas about how to manage atrial fibrillation, how to prevent stroke, and incorporate some of these new agents. And so the purpose is really to synthesize our comments into a multidisciplinary document that gives very concrete and concise recommendations on how to treat patients with atrial fibrillation with regard to stroke prevention. And these are very practical guidance. How to start patients on new agents. How do you deal with life-threatening bleeding? What about patients with kidney dysfunction? Because we know about that can impact how long the new drugs stay around in the bloodstream. And these are all questions that many of us have received in very different venues across the nation, across the world, that people are really struggling with when they consider implementing these new paradigms of treatment in atrial fibrillation. And what we hope is at the end of this initiative that we have a document that really reflects the broad spectrum of input from our specialists and nurses, across the entire spectrum of people who are stakeholders in atrial fibrillation, and that this will be an invaluable resource for healthcare providers as they see patients in their clinic, where you have the information from the clinical trials, you have the information from the national consensus documents, international consensus documents, expert advice, all in one area, easy to read, well referenced, that someone could flip through very quickly when they have a specific question about a patient sitting in front of them. I think this document, this initiative really offers a unique ability to bring together all of these stakeholders in one place for the mission of providing a very concise and concrete document for the local healthcare provider. We're very excited. We have an incredible panel of experts that will be convening in May 2014, and we look forward to providing that document through publication soon after. Thank you.